Wes Moore's push for health innovation. Maryland's role in prescription for a healthy America. Governor Wes Moore of Maryland raised a critical question during a recent governor's session with a federal health official about advancing population health initiatives.
Thanks so much, Governor, and I'll be brief. And Mr. Secretary, thank you so much. And we're thankful for the chance to also work with you. As you know, Maryland was the first Democratic state to sign up for the prescription for the initiative for the prescription for a healthy America. And we are working on a lot of things when it comes to chronic health, dealing with population health, nutrition, et cetera. I do know one important component to that as well, though, is the future of the AHEAD model, which we're working on standing up. And I know if you think about cohort 2, I believe Vermont and also Hawaii are in cohort 2. So the question is just, how are you thinking about the future for the implementation and the standing up of the AHEAD model, and what can we as governors do to be helpful with that?
You know, those are evaluated case by case, and you're gonna have Oz up here in a little while, and he's the one who's gonna make that judgment call on the Maryland system. But you know, we support waivers that are helping people, that we're encouraging states to become laboratories for innovation and for figuring out ways to deal with these big issues state by state. And but he'll be able to answer more particularly exactly what's going on in Maryland.
Thank you, Mr. Secretary. I was just thinking, the people sitting around this table got into this job that we've gotten into because we care deeply about the people in our states, and we have decided to use our lives to impact their life for good. We all share that same passion for our people. It's the reason that we are serving to a person. And what I appreciate about you and your work is, I believe, and we see it in your passion and in your heart for the work that you're doing. It's because you care about this issue, and you care about America, and you want to lean into this in ways to challenge the status quo in ways that may change the trajectory of the health of this country forever. And for that, we are very grateful and honored that you came to join us today. So let us thank the Secretary. Thank you very much. Thank you.
Maryland was the first Democratic-led state to adopt this federal prescription initiative. The program focuses on population health and chronic disease management, meaning states design unique strategies to address community health challenges. The AHEAD model acts as a waiver-based innovation program, allowing states flexibility to test new approaches and serve as laboratories of innovation. Moore asked about the future of the AHEAD model and how states like Maryland can help implement and shape it going forward. He highlighted cohort 2 states, Vermont and Hawaii, as examples, signaling that Maryland wants clarity and potentially similar opportunities. The health secretary emphasized case-by-case evaluation and affirmed support for waivers that improve people's lives. Specific decisions for Maryland will be made by federal health administrators, but the overall tone was encouraging state-led experimentation. This exchange reveals how states and the federal government collaborate on health innovation. Viewers should note, state flexibility is growing. Maryland and others can shape their health policies under federal oversight. Programs like AHEAD are experimental but pivotal. They could redefine chronic care, nutrition programs, and cost control nationwide. Governors are taking active roles, and Moore's engagement shows leadership in leveraging federal initiatives for local needs. For policymakers and citizens, tracking these programs matters, as they can directly affect access to care, preventive health strategies, and state budgets. If you care about how your state shapes the future of healthcare, from chronic disease solutions to innovative nutrition programs, stay informed with us. Hit subscribe and turn on notifications so you never miss updates on health policy that could change lives in your community.